Question 1. The monitoring system demonstrates a recurring pattern of medication errors related to a specific dosage calculation for a newly implemented intravenous antibiotic. While the immediate impact on patients has been minor, the potential for serious harm is significant. The chief nursing officer is concerned about potential negative media attention and the impact on the hospital's reputation if this issue becomes public before a definitive solution is found. She suggests a quiet, internal review to identify the cause and implement a fix before any formal reporting occurs. Which of the following actions best aligns with established quality improvement frameworks and professional ethical obligations in this situation? Option A. Conduct a discrete internal review to identify the specific nurses involved and provide them with additional training, without formally reporting the pattern of errors to the Quality Improvement Department until a complete resolution is achieved. Option B. Address the medication errors through informal discussions with the pharmacy and nursing staff involved, focusing on individual accountability and reinforcing existing protocols without initiating a formal quality improvement project. Option C. Delay reporting the medication error pattern to the Quality Improvement Department and instead focus on gathering data to demonstrate that the errors are infrequent and do not pose a significant risk, to avoid unnecessary alarm and potential reputational damage. Option D. Immediately report the pattern of medication errors to the hospital's Quality Improvement Department and initiate a formal continuous quality improvement (CQI) process to investigate the root cause and implement system-wide solutions, while also considering reporting to a patient safety organization. So, under the Patient Safety and Quality Improvement Act of 2005. The correct answer is D. Immediately report the pattern of medication errors to the hospital's Quality Improvement Department and initiate a formal continuous quality improvement (CQI) process to investigate the root cause and implement system-wide solutions, while also considering reporting to a patient safety organization. So, under the Patient Safety and Quality Improvement Act of 2005. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a healthcare organization's commitment to patient safety and quality improvement is challenged by the potential for negative publicity and financial repercussions. The tension lies between transparently addressing a quality issue, which aligns with TQM and CQI principles, and the desire to mitigate immediate negative consequences. Professionals must balance their duty to report and improve with organizational pressures. Correct approach analysis. The correct approach, which involves immediate reporting and initiating a formal CQI process, represents best professional practice because it directly upholds the core tenets of both TQM and CQI. TQM emphasizes a systemic approach to quality, requiring open communication and a commitment to continuous improvement across all levels. CQI, as a practical application of TQM, mandates the systematic identification, analysis, and resolution of quality issues. In the U.S. regulatory framework, this aligns with the Patient Safety and Quality Improvement Act of 2005, PSQIA, which encourages reporting of patient safety events to patient safety organizations, for analysis and improvement without fear of discovery and litigation. Furthermore, the Centers for Medicare and Medicaid Services, CMS, conditions of participation require hospitals to have robust quality assessment and performance improvement programs, necessitating the reporting and addressing of adverse events. Ethically, this approach prioritizes patient well-being and the organization's responsibility to learn from errors, fostering a culture of safety. Incorrect approaches analysis. One incorrect approach involves delaying reporting to conduct an internal investigation without involving external quality improvement mechanisms. This fails to adhere to CQI principles by potentially hindering objective analysis and delaying corrective actions. It also risks violating CMS requirements for timely quality assessment and performance improvement. Ethically, it can be seen as an attempt to conceal or downplay a quality issue, undermining patient trust and the organization's commitment to transparency. Another incorrect approach is to address the issue informally without a structured quality improvement framework. This bypasses the systematic data collection, analysis, and root cause identification central to TQM and CQI. It is unlikely to lead to sustainable improvements and may result in recurring issues. From a regulatory standpoint, it does not meet the requirements for a formal quality assessment and performance improvement program mandated by CMS. Ethically, it demonstrates a lack of commitment to robust patient safety protocols. A third incorrect approach is to attribute the issue solely to individual staff error without exploring systemic factors. This contradicts the TQM philosophy of shared responsibility for quality, and the CQI focus on identifying system-level vulnerabilities can lead to a punitive rather than a learning culture, discouraging future reporting and hindering effective problem-solving. This approach also fails to meet the comprehensive analysis expected in quality improvement initiatives under regulatory frameworks. Professional reasoning. Professionals should employ a decision-making process that prioritizes patient safety and regulatory compliance. This involves 1. Recognizing the quality issue and its potential impact. 2. Immediately initiating the organization's established reporting protocols for patient safety events, aligning with CQI. 3. Engaging the quality improvement team and relevant stakeholders to conduct a thorough, systematic analysis using TQM principles. 4. Ensuring all actions are documented and comply with relevant regulations, such as those from CMS and the PSKIA. 5. Focusing on system improvements rather than solely on individual blame. This systematic and transparent approach ensures accountability, promotes a culture of learning, and ultimately enhances patient care. Question 2. The control framework reveals a bottleneck in the patient discharge process, leading to extended lengths of stay and increased patient dissatisfaction. Which approach best optimizes this process while adhering to healthcare quality and patient safety principles? Option A. Reduce the number of nursing staff on the discharge unit during peak hours to reallocate resources to other areas experiencing higher patient volumes. Option B. Implement a multidisciplinary discharge planning team that utilizes standardized checklists and real-time communication to coordinate care transitions and patient education. Option C. Expedite the discharge process by allowing patients to leave without a comprehensive medication reconciliation or follow-up appointment scheduling, relying on them to manage these aspects post-discharge. Option D. Focus solely on reducing the documentation time for discharge summaries, assuming that faster paperwork will naturally lead to quicker patient departures. The correct answer is B. Implement a multidisciplinary discharge planning team that utilizes standardized checklists and real-time communication to coordinate care transitions and patient education. Explanation. The control framework reveals a need to optimize a patient care process. This scenario is professionally challenging because it requires balancing efficiency gains with maintaining or improving patient safety and quality of care, all within the specific regulatory landscape of the Certified in Healthcare Quality and Patient Safety (CHQPS) domain, which implies adherence to U.S. federal and state healthcare regulations, as well as relevant professional standards. Careful judgment is required to select an approach that is both effective and compliant. The correct approach represents best professional practice because it directly addresses the identified inefficiencies through a systematic, data-driven methodology that prioritizes patient outcomes and safety. This aligns with the core principles of healthcare quality improvement, which emphasize continuous assessment and refinement of processes to reduce errors, enhance patient satisfaction, and achieve better clinical results. Such an approach is inherently compliant with regulations like the Affordable Care Act, ACA, provisions related to quality reporting and value-based purchasing, as well as the patient safety initiatives promoted by organizations like the Agency for Healthcare Research and Quality (AHQ). An incorrect approach that focuses solely on cost reduction without considering the impact on patient care processes or outcomes would represent a significant regulatory and ethical failure. This could violate the duty of care owed to patients and potentially contravene regulations mandating the provision of safe and effective care. For instance, implementing changes that increase wait times or reduce staff-to-patient ratios without a thorough risk assessment could lead to adverse events, violating patient safety standards, and potentially triggering penalties under programs like the Hospital Readmissions Reduction Program, HRRP, if patient outcomes worsen. Another incorrect approach that bypasses established quality improvement methodologies, such as Lean or Six Sigma, and instead relies on anecdotal evidence or the opinions of a few individuals, would be professionally unacceptable. This demonstrates a lack of commitment to evidence-based practice and a failure to engage in rigorous, systematic problem-solving. Such an approach risks introducing new errors or exacerbating existing ones, undermining the organization's commitment to quality and patient safety, and failing to meet the expectations of regulatory bodies that require demonstrable quality improvement efforts. The professional decision-making process for similar situations should involve a structured approach. First, clearly define the problem and its impact on patient care and safety. Second, gather and analyze relevant data to understand the root causes of inefficiency. Third, identify potential solutions, evaluating each for its impact on quality, safety, efficiency, and regulatory compliance. Fourth, select the most appropriate solution based on evidence and risk assessment. Fifth, implement the chosen solution with a robust monitoring plan to track outcomes and make necessary adjustments. Finally, document the entire process and its results for continuous learning and accountability. Question 3. Stakeholder feedback indicates a need to enhance the organization's understanding of patient safety events and the patient experience of care. Which of the following data collection methods would best support a comprehensive and ethically sound approach to quality measurement in this context, adhering to U.S. regulatory frameworks? Option A. Retrospective review of medical charts to identify documented safety concerns. Option B. A combination of incident reporting system data for adverse events and patient satisfaction surveys for experiential feedback. Option C. Collection of self-reported safety practice data directly from clinical staff. Option D. Analysis of administrative claims data to track process adherence and outcomes. The correct answer is B. A combination of incident reporting system data for adverse events and patient satisfaction surveys for experiential feedback. Explanation. This scenario presents a common challenge in healthcare quality improvement, selecting the most appropriate data collection method to accurately assess patient safety and satisfaction, while adhering to regulatory requirements and ethical considerations. The challenge lies in balancing the need for comprehensive data with resource constraints and the potential for data collection to disrupt patient care. Careful judgment is required to choose a method that is both effective and efficient, and that respects patient privacy and autonomy. The correct approach represents best professional practice because it prioritizes a multi-method strategy that leverages both objective and subjective data. This aligns with the principles of robust quality measurement, which requires a holistic view of performance. Utilizing incident reporting systems provides objective data on adverse events, while patient surveys offer subjective insights into patient experiences and perceptions of safety. Combining these methods allows for a more comprehensive understanding of quality and safety issues, enabling targeted interventions. This approach is ethically sound as it respects patient voice and promotes transparency in quality reporting, consistent with the spirit of regulations like the Affordable Care Act's focus on patient experience and quality outcomes, and the Health Insurance Portability and Accountability Act, HIPAA, regarding data privacy when collecting and reporting information. An incorrect approach that relies solely on retrospective chart reviews for quality measurement is professionally unacceptable. While chart reviews can provide valuable objective data, they are inherently limited in capturing real-time safety events or the nuances of patient experience. This method may fail to identify systemic issues that are not explicitly documented in the medical record and overlooks the patient's perspective, which is crucial for understanding the impact of care. Ethically, this approach neglects the patient's voice and may lead to a skewed understanding of quality, potentially failing to address patient-centered concerns. Another incorrect approach, focusing exclusively on administrative data for quality assessment, is also professionally unacceptable. Administrative data, while useful for tracking process metrics and resource utilization, often lacks the granularity to assess the quality of clinical care or patient safety events. It may not capture adverse events that do not result in a change in billing or reimbursement. Relying solely on this data can lead to a superficial understanding of quality, potentially masking critical safety issues and failing to meet regulatory expectations for comprehensive quality reporting. Finally, an approach that exclusively uses staff self-reported data on safety practices without independent verification is professionally problematic. While staff insights are valuable, self-reported data can be subject to bias, social desirability, and a lack of objective validation. This method may not accurately reflect actual practice or identify areas where adherence to safety protocols is lacking. Ethically, it can create a false sense of security and fail to hold individuals and the organization accountable for actual safety performance, potentially violating principles of accountability and continuous improvement mandated by quality frameworks. Professionals should employ a decision-making framework that begins with clearly defining the quality or safety metric to be measured. This should be followed by an assessment of available resources, potential data sources, and the specific information needed to drive improvement. A critical step involves considering the ethical implications of data collection, including patient privacy, informed consent, where applicable, and the potential impact on patient care. Regulatory requirements must be integrated into the selection process to ensure compliance. Finally, a multi-method approach, where feasible, is often the most robust and ethically sound strategy for comprehensive quality and safety measurement. Question 4. Investigation of a significant discrepancy between a reported key performance indicator, KPI, for patient falls and the actual number of falls documented in incident reports, where the KPI appears to be artificially low, presents an ethical and regulatory challenge. The quality improvement team is aware of the data inconsistency. What is the most appropriate course of action for the healthcare quality professional? Option A. Focus communication efforts on external stakeholders to explain the KPI in a way that minimizes the appearance of a problem, without directly addressing the underlying data inconsistency. Option B. Initiate a thorough investigation into the data collection and reporting processes to identify the cause of the discrepancy and ensure accurate reporting of all patient safety events, regardless of the impact on the KPI. Option C. Continue reporting the existing KPI without further investigation, assuming the discrepancy is a minor anomaly that will resolve itself over time. Option D. Adjust the data entry parameters retrospectively to align the reported KPI with the desired performance target, citing a need to maintain organizational reputation. Correct answer is B. Initiate a thorough investigation into the data collection and reporting processes to identify the cause of the discrepancy and ensure accurate reporting of all patient safety events, regardless of the impact on the KPI. Explanation. Scenario analysis. This scenario presents a professional challenge because it pits the ethical imperative of transparent quality reporting against the organizational pressure to maintain favorable performance metrics. The healthcare quality professional is caught between the duty to accurately reflect patient safety outcomes and the potential negative repercussions of reporting data that might reflect poorly on the organization. This requires careful judgment to balance competing obligations and ensure patient safety remains paramount. Correct approach analysis. The correct approach involves a thorough investigation of the discrepancy, followed by transparent reporting of the findings, regardless of the impact on the KPI. This aligns with the core principles of healthcare quality and patient safety, which prioritize accurate data for improvement and accountability. Regulatory frameworks, such as those overseen by CMS, Centers for Medicare and Medicaid Services, in the U.S., mandate accurate reporting of quality and safety data. Ethically, healthcare professionals have a duty to be truthful and transparent, especially when patient well-being is at stake. Failing to report accurate data can lead to misinformed decision-making, hinder improvement efforts, and potentially endanger future patients. Incorrect approach is analysis. One incorrect approach is to ignore the discrepancy and continue reporting the inflated KPI. This represents a significant ethical failure by engaging in data misrepresentation, which violates principles of honesty and integrity. From a regulatory standpoint, this could be considered a violation of reporting requirements, potentially leading to penalties or loss of accreditation if discovered. It also undermines the entire purpose of KPIs, which is to drive improvement. Another incorrect approach is to adjust the data collection methodology retrospectively to align with the desired KPI without a valid, documented reason for the change. This is a form of data manipulation, which is ethically unsound and regulatory noncompliant. It creates a false impression of performance and prevents genuine identification of areas needing improvement. Such actions can erode trust among stakeholders, including patients, payers, and regulatory bodies. A third incorrect approach is to focus solely on external pressures and attempt to spin the data to appear more favorable without addressing the underlying quality issue. While communication is important, it should be based on accurate data. Misrepresenting the situation or downplaying serious safety events is ethically problematic and can lead to a culture of denial rather than one of continuous improvement. Regulatory bodies expect proactive identification and mitigation of risks, not just superficial reporting. Professional reasoning. Professionals facing such a dilemma should first engage in a systematic investigation to understand the root cause of the KPI discrepancy. This involves reviewing data collection processes, identifying potential errors, and assessing the actual patient safety events. Transparency with leadership and relevant stakeholders about the findings is crucial. The focus should always be on using data to identify and address patient safety risks, rather than on manipulating metrics. Adherence to professional codes of ethics and relevant regulatory guidelines, e.g., those from CMS. The Joint Commission provides a framework for making sound decisions that prioritize patient well-being and organizational integrity. Question 5. What factors determine the most appropriate methodology for assessing potential risks in a newly implemented patient care pathway, considering the need for proactive identification and mitigation of failures? Option A. The historical preference for a particular quality improvement tool within the organization, regardless of its current applicability. Option B. The availability of staff training on a specific risk assessment tool, irrespective of its suitability for the task. Option C. The perceived complexity of the new patient care pathway without a formal assessment of potential failure points. Option D. The inherent nature of the process being assessed, proactive vs. reactive risk identification, and the potential severity of identified failure modes. The correct answer is D. The inherent nature of the process being assessed, proactive vs. reactive risk identification, and the potential severity of identified failure modes. Explanation. This scenario is professionally challenging because it requires a healthcare organization to select the most appropriate proactive risk assessment tool for a new, complex patient care process. The choice between root cause analysis (RCA) and failure mode effects analysis (FME) is critical, as each has distinct strengths and applications. Misapplication can lead to ineffective risk mitigation, wasted resources, and ultimately, potential patient harm, which directly contravenes the core principles of patient safety and quality mandated by regulatory bodies. Careful judgment is required to align the tool's capabilities with the specific needs of the situation. The correct approach represents best professional practice because FME is inherently designed for proactive risk assessment of processes before an adverse event occurs. It systematically identifies potential failure modes, their causes, and their effects, allowing for the implementation of preventive measures. This aligns with the CHQPS focus on preventing harm and improving system reliability. Regulatory frameworks, such as those promoted by the Joint Commission, if this were a US-based exam, emphasize proactive risk assessment and the implementation of strategies to mitigate identified hazards, making FME the superior choice for a new process. An incorrect approach would be to solely rely on RCA for a new process. RCA is a reactive tool, best suited for investigating adverse events after they have occurred to understand why they happened and prevent recurrence. Using RCA proactively for a new process is a fundamental misapplication of the methodology, failing to leverage its strengths for anticipating and preventing potential failures. This would be a regulatory failure as it demonstrates a lack of understanding of appropriate quality improvement methodologies and a missed opportunity to prevent harm, which is a core expectation of patient safety standards. Another incorrect approach would be to choose a tool based solely on its perceived ease of implementation, without considering its suitability for the specific risk assessment need. This demonstrates a lack of professional diligence and a failure to prioritize patient safety over operational convenience. It could lead to a superficial analysis that misses critical risks, thereby failing to meet regulatory expectations for thorough risk management. Finally, selecting a tool based on historical preference without a current needs assessment is also professionally unsound. Quality improvement tools should be chosen based on their ability to address the current challenges and risks effectively. Sticking to outdated practices without evaluating their current relevance can lead to suboptimal outcomes and a failure to adapt to evolving patient care complexities, which is contrary to the continuous improvement ethos expected in healthcare quality and patient safety. The professional decision-making process for similar situations should involve a thorough understanding of the available quality improvement and patient safety tools, their intended applications, and the specific characteristics of the process or event being addressed. A systematic evaluation of the problem's nature, proactive vs. reactive, complexity, and potential impact should guide the selection of the most appropriate methodology. This ensures that resources are used effectively, and that the chosen approach will yield the most robust and beneficial outcomes for patient safety. Question 6. When evaluating the suitability of quality improvement models such as Plan Do Study Act, PDSA, Six Sigma, and Lean for addressing a specific patient safety concern within a healthcare organization, which approach best reflects a professional and effective decision-making process? Option A. Conduct a thorough analysis of the patient safety concerns complexity, potential root causes, and the organization's existing infrastructure and resources. Then select the model that best aligns with these factors and the desired outcomes. Option B. Prioritize the model that requires the least amount of staff training and implementation time, assuming that speed is the most critical factor in addressing patient safety issues. Option C. Select the model that has yielded the most impressive results in external case studies, regardless of the specific nature of the patient safety concern or the organization's internal capacity. Option D. Implement a combination of all three models simultaneously across all departments to ensure comprehensive coverage of quality improvement strategies. The correct answer is C. Select the model that has yielded the most impressive results in external case studies, regardless of the specific nature of the patient safety concern or the organization's internal capacity. Explanation: the scenario presents a common challenge in healthcare quality improvement, selecting the most appropriate methodology for a specific problem. The professional challenge lies in understanding the nuances of each model and aligning them with the organization's goals, resources, and the nature of the quality issue. Careful judgment is required to avoid misapplying a model, leading to wasted effort, ineffective solutions, and potential patient safety risks. The correct approach, which involves a systematic evaluation of the problem's complexity and the organization's capacity, represents best professional practice because it prioritizes evidence-based decision-making and resource optimization. This aligns with the core principles of healthcare quality and patient safety, which mandate the use of effective and efficient strategies to improve outcomes. Regulatory frameworks, such as those overseen by the Centers for Medicare and Medicaid Services, CMS, in the U.S., emphasize the importance of continuous quality improvement and the use of validated methodologies to achieve measurable improvements in patient care. Ethical considerations also demand that resources are used judiciously to maximize patient benefit. An incorrect approach that rigidly applies a single model without considering the problem's context is professionally unacceptable. For instance, using Six Sigma for a simple, well-defined process issue might be overly complex and resource-intensive, failing to leverage the agility of PDSA. This could be seen as a failure to adhere to principles of efficient resource allocation, potentially impacting other quality initiatives. Conversely, using PDSA for a highly complex, systemic issue with multiple root causes might lack the rigorous data analysis and statistical rigor needed for a robust solution, potentially leading to superficial improvements or a failure to address the underlying problems, which could have patient safety implications and violate the spirit of regulatory requirements for substantial quality improvement. Another incorrect approach might be to adopt lean principles without adequate staff training and buy-in, leading to resistance and failed implementation, which undermines the organization's commitment to quality and patient safety. The professional decision-making process should involve a thorough assessment of the quality problem, including its scope, complexity, and potential impact on patient safety. This assessment should then be followed by an evaluation of the available quality improvement models, considering their strengths, weaknesses, and suitability for the identified problem and the organization's capabilities. Collaboration with stakeholders, including frontline staff and leadership, is crucial to ensure buy-in and successful implementation. The chosen model should be adaptable and subject to ongoing evaluation to ensure its effectiveness. Question 7. Quality control measures reveal a statistically significant increase in adverse events related to medication administration within a specific unit. Which of the following approaches best addresses this finding to improve patient safety and healthcare quality, adhering to U.S. regulatory frameworks? Option A. Immediately implement a new, unproven medication administration system across the entire hospital based on the initial data, without further investigation or staff input. Option B. Convene a multidisciplinary team, including nursing, pharmacy, and quality improvement specialists, to conduct a root cause analysis of the reported adverse events, review medication administration protocols, and develop targeted interventions, ensuring all patient data is handled in accordance with HIPAA. Option C. Focus solely on identifying and disciplining the individual staff members directly involved in the reported adverse events without a broader systemic review. Option D. Share the raw, de-identified adverse event data with all hospital staff via a general email announcement to raise awareness of the issue. The correct answer is B. Convene a multidisciplinary team, including nursing, pharmacy, and quality improvement specialists, to conduct a root cause analysis of the reported adverse events, review medication administration protocols, and develop targeted interventions, ensuring all patient data is handled in accordance with HIPAA. Explanation: this scenario presents a common implementation challenge in healthcare quality improvement, balancing the immediate need for data-driven decision-making with the ethical and regulatory imperative to ensure patient safety and privacy. The challenge lies in interpreting quality control findings in a way that leads to actionable improvements without compromising patient confidentiality or violating established healthcare regulations. The correct approach prioritizes a systematic, multidisciplinary review of the quality control findings. This aligns with best professional practice by ensuring that improvements are evidence-based, consider all relevant aspects of care delivery, and involve stakeholders who can implement change. Specifically, within the U.S. regulatory framework governing healthcare quality and patient safety, this approach is supported by principles embedded in the Affordable Care Act, ACA, and regulations from the Centers for Medicare and Medicaid Services, CMS, that mandate quality reporting and improvement initiatives. The Health Insurance Portability and Accountability Act, HIPAA, also guides how patient information is handled during such reviews, emphasizing de-identification and authorized access. This method fosters a culture of continuous improvement, a core tenet of patient safety, by systematically identifying root causes and developing targeted interventions. An incorrect approach that focuses solely on immediate punitive action based on raw data without thorough investigation fails to adhere to due process and can lead to misinterpretations and unfair consequences. This violates ethical principles of fairness and can undermine staff morale, hindering future quality improvement efforts. Furthermore, such an approach might inadvertently lead to breaches of patient privacy if data is not handled according to HIPAA guidelines. Another incorrect approach that involves bypassing established quality improvement committees and directly implementing changes based on a single individual's interpretation overlooks the importance of collaborative decision-making and expert consensus. This can lead to poorly designed interventions that are ineffective or even detrimental to patient care. It also bypasses the structured review processes mandated by many healthcare organizations and regulatory bodies for significant changes in practice. A third incorrect approach that involves sharing raw, de-identified data with external entities without proper authorization or a clear quality improvement purpose risks violating HIPAA regulations and could lead to unintended consequences or misuse of sensitive information. While data sharing for research or public health purposes is sometimes permitted, it requires strict adherence to privacy rules and Institutional Review Board (IRB) approvals, which are not implied in this scenario. The professional decision-making process for similar situations should involve 1. Acknowledging the quality control findings and their potential impact. 2. Initiating a structured review process involving relevant quality improvement teams and subject matter experts. 3. Ensuring all data handling complies with HIPAA and other relevant privacy regulations. 4. Identifying root causes through a systematic investigation, not just surface-level observations. 5. Developing evidence-based, actionable improvement strategies. 6. Implementing and monitoring the effectiveness of these strategies. 7. Communicating findings and changes appropriately to stakeholders. Question 8. The control framework reveals that a healthcare organization's quality improvement team has developed an innovative protocol designed to significantly reduce medication errors. The team is eager to implement this protocol immediately to enhance patient safety. However, the protocol deviates from current established federal guidelines regarding medication administration documentation. The team is debating the best course of action to ensure both rapid implementation and regulatory compliance. Which of the following actions best balances the urgency of quality improvement with the imperative of regulatory adherence? Option A. Initiate a pilot program for the protocol in a controlled environment, simultaneously engaging with the federal regulatory agency to seek guidance and explore options for a formal variance or approval process before wider rollout. Option B. Immediately implement the protocol and then submit a request for a retrospective review and potential waiver from the relevant federal regulatory agency, citing patient safety benefits. Option C. Halt implementation of the protocol until a formal amendment to the existing federal guidelines can be proposed and approved, which could be a lengthy process. Option D. Proceed with implementation, assuming that the demonstrated improvement in patient safety will be sufficient justification for any potential regulatory noncompliance discovered during future audits. The correct answer is B. Immediately implement the protocol and then submit a request for a retrospective review and potential waiver from the relevant federal regulatory agency, citing patient safety benefits. Explanation: the control framework reveals a common challenge in healthcare quality improvement, balancing the need for rapid innovation with the stringent requirements of regulatory compliance. The scenario presents a quality improvement team eager to implement a novel patient safety protocol. However, the team's initial approach risks bypassing established regulatory pathways, potentially leading to non-compliance and undermining the very safety goals they aim to achieve. This situation is professionally challenging because it requires careful navigation between the imperative to improve patient care and the legal and ethical obligations to adhere to established standards and oversight mechanisms. The correct approach represents best professional practice because it prioritizes a systematic, compliant integration of the quality improvement initiative. By engaging with the relevant regulatory bodies and seeking necessary approvals or waivers before full implementation, the team demonstrates a commitment to patient safety that is both effective and legally sound. This aligns with the core principles of healthcare quality and patient safety, which emphasize evidence-based practice, risk mitigation, and adherence to the regulatory framework designed to protect patients. This proactive engagement ensures that the initiative is vetted for safety, efficacy, and compliance, thereby minimizing risks of adverse events or regulatory sanctions. An incorrect approach that focuses solely on rapid implementation without regulatory consultation fails to acknowledge the critical role of oversight in patient safety. This approach risks introducing unvetted practices that could inadvertently harm patients or violate existing regulations, leading to potential legal repercussions and reputational damage for the organization. Another incorrect approach that assumes existing regulations are inherently prohibitive without exploring avenues for adaptation or waivers overlooks the dynamic nature of regulatory frameworks, which often include provisions for innovation when patient benefit is clearly demonstrated. This can stifle progress and prevent the adoption of potentially life-saving improvements. A third incorrect approach that prioritizes internal approval over external regulatory engagement neglects the broader public trust and accountability inherent in healthcare delivery. Regulatory bodies exist to ensure a baseline standard of care and patient protection across the healthcare system, and bypassing them undermines this essential function. Professionals should employ a decision-making framework that begins with a thorough understanding of the existing regulatory landscape relevant to the proposed initiative. This involves identifying all applicable laws, regulations, and guidelines. Next, they should assess the proposed initiative against these requirements, identifying any potential conflicts or areas where clarification or modification is needed. The crucial step is to proactively engage with the relevant regulatory authorities to discuss the initiative, seek guidance, and explore options for compliance, including potential waivers or pilot program approvals. This collaborative approach ensures that quality improvement efforts are not only innovative, but also safe, effective, and fully compliant, ultimately serving the best interests of patients and the healthcare organization. Question 9. The performance metrics show an upward trend in medication errors, hospital-acquired infections, and patient falls. As a quality and patient safety leader, which of the following strategies would be most effective in addressing these common patient safety issues while adhering to U.S. regulatory frameworks for healthcare quality improvement? Option A. Implement a comprehensive, data-driven quality improvement plan that includes root cause analyses for significant events, evidence-based interventions for each identified issue, and continuous monitoring of key performance indicators. Option B. Rely on informal feedback from frontline staff and patient surveys to guide the development of new safety protocols, without formal data collection or analysis. Option C. Prioritize disciplinary actions for staff members directly involved in patient safety incidents to deter future errors and ensure accountability. Option D. Focus on implementing a single, organization-wide initiative, such as mandatory retraining on basic safety protocols, without specific targeting of the root causes for each type of incident. The correct answer is A. Implement a comprehensive data-driven quality improvement plan that includes root cause analyses for significant events, evidence-based interventions for each identified issue, and continuous monitoring of key performance indicators. Explanation: this scenario is professionally challenging because it requires balancing immediate patient safety concerns with systemic quality improvement initiatives, all while adhering to specific regulatory requirements for patient safety reporting and data analysis within the U.S. healthcare framework. The pressure to demonstrate improvement in medication errors, infections, and falls necessitates a data-driven approach that is both compliant and effective. The correct approach represents best professional practice because it directly addresses the identified performance gaps through a multifaceted strategy that includes root cause analysis, evidence-based intervention, and continuous monitoring. This aligns with the core principles of patient safety and quality improvement mandated by regulatory bodies such as the Centers for Medicare and Medicaid Services, CMS, and the Joint Commission. Specifically, the focus on identifying contributing factors to medication errors, e.g., look-alike/sound-alike drugs, inadequate staffing, implementing evidence-based protocols for infection prevention, e.g., hand hygiene, environmental cleaning, and developing comprehensive fall prevention programs, e.g., risk assessment, patient education, are all recognized best practices. The commitment to ongoing data collection and analysis ensures that interventions are effective and can be adapted as needed, fostering a culture of continuous improvement. An incorrect approach that focuses solely on punitive measures for staff involved in errors fails to address the systemic issues that contribute to patient safety events. This approach is ethically problematic as it does not uphold the principle of a just culture, which encourages reporting without fear of retribution, thereby hindering learning and improvement. From a regulatory standpoint, it may also violate guidelines that emphasize system-wide solutions rather than individual blame, potentially leading to underreporting of errors and a false sense of security. Another incorrect approach that involves implementing a single, broad intervention without specific targeting or data analysis is inefficient and unlikely to yield significant improvements. This lacks the rigor required by quality improvement methodologies and regulatory expectations for evidence-based practice. It fails to address the unique contributing factors for each type of safety issue, leading to wasted resources and potentially overlooking critical areas for improvement. A third incorrect approach that relies on anecdotal evidence or staff opinions without robust data collection and analysis is insufficient for demonstrating compliance with regulatory requirements for quality reporting and performance improvement. Regulatory bodies expect objective data to drive decision-making and to validate the effectiveness of interventions. Relying on subjective information can lead to misdirected efforts and a failure to identify true areas of concern, potentially exposing the organization to scrutiny and non-compliance. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly analyze the performance data to identify trends in specific areas of concern. Second, engage multidisciplinary teams to conduct root cause analyses for significant events. Third, research and select evidence-based interventions tailored to the identified issues. Fourth, implement these interventions with clear protocols and training. Fifth, establish robust data collection mechanisms to monitor the impact of interventions and identify further areas for improvement. Finally, ensure all processes align with relevant U.S. healthcare regulations and accreditation standards, fostering a culture of safety and continuous learning. Question 10. Benchmark analysis indicates that a healthcare organization has identified opportunities for improvement across the dimensions of quality. Which of the following approaches best reflects a comprehensive strategy for addressing these opportunities in alignment with best practices and regulatory expectations? Option A. Focus exclusively on enhancing patient comfort and communication through expanded amenities and staff training, assuming that improved patient experience will naturally lead to better clinical outcomes. Option B. Prioritize cost reduction measures by streamlining workflows and reducing staffing levels, with the expectation that increased efficiency will automatically translate to higher quality care across all dimensions. Option C. Conduct a comprehensive review of patient safety protocols and implement new technologies to enhance surgical precision, without explicitly measuring the impact on patient-centeredness or equity of access to these advanced procedures. Option D. Implement a targeted initiative to reduce wait times for appointments and procedures, while simultaneously developing a robust system for tracking adverse events and patient satisfaction scores related to these changes. The correct answer is D. Implement a targeted initiative to reduce wait times for appointments and procedures, while simultaneously developing a robust system for tracking adverse events and patient satisfaction scores related to these changes. Explanation: this scenario presents a professional challenge because it requires a healthcare organization to move beyond simply identifying quality gaps to actively implementing and evaluating strategies that address multiple, interconnected dimensions of healthcare quality. The challenge lies in balancing competing priorities, ensuring that improvements in one dimension do not inadvertently compromise another, and demonstrating measurable progress in a way that aligns with regulatory expectations and ethical obligations to patients. Careful judgment is required to select an approach that is not only theoretically sound, but also practically implementable and demonstrably effective within the specific context of the organization. The correct approach represents best professional practice because it focuses on a systematic, evidence-based evaluation of interventions across all 6 dimensions of quality. This aligns with the core principles of healthcare quality improvement, which emphasize a holistic and patient-centered perspective. By using a framework that explicitly considers safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity, the organization demonstrates a commitment to comprehensive quality care. This approach is ethically justified as it prioritizes patient well-being by seeking to optimize all aspects of their healthcare experience. Regulatory frameworks, such as those overseen by the Centers for Medicare and Medicaid Services, CMS, and the Agency for Healthcare Research and Quality (AHQ) in the U.S., often mandate or encourage such comprehensive quality assessment and improvement initiatives. This approach ensures that improvements are sustainable and address the multifaceted needs of diverse patient populations, thereby promoting equity. An incorrect approach that focuses solely on improving efficiency without considering the impact on patient safety or effectiveness would be professionally unacceptable. This failure stems from a narrow, potentially profit-driven perspective that neglects the fundamental ethical duty to provide safe and effective care. Such an approach could lead to adverse events, reduced patient satisfaction, and ultimately, non-compliance with regulations that prioritize patient outcomes. Another incorrect approach that prioritizes patient-centeredness through extensive patient feedback mechanisms, but neglects to measure the effectiveness or safety of interventions would also be professionally flawed. A patient experience is crucial. An organization has an ethical and regulatory obligation to ensure that the care provided is medically sound and minimizes harm. Without measuring effectiveness and safety, the organization cannot definitively state that the patient-centered initiatives are leading to better health outcomes or preventing adverse events. This approach risks creating a perception of quality without delivering tangible improvements in clinical outcomes or safety. Finally, an approach that focuses exclusively on achieving high scores in one dimension, such as timeliness, without a concurrent assessment of other dimensions, is also professionally deficient. This siloed approach fails to recognize the interconnectedness of quality dimensions. For instance, rushing to improve timeliness might compromise safety or effectiveness if protocols are bypassed or staff are overburdened. Ethically, this demonstrates a lack of comprehensive care. From a regulatory standpoint, it may lead to deficiencies in other areas that are also subject to oversight. The professional decision-making process for similar situations should involve a multi-stakeholder approach to quality assessment. This includes engaging clinical staff, quality improvement professionals, administrators, and patients. The process should begin with a thorough understanding of the organization's current performance across all 6 dimensions of quality, using established metrics and benchmarks. Interventions should be designed to address identified gaps in a way that considers potential impacts on all dimensions. Pilot testing and ongoing monitoring are essential to evaluate the effectiveness of interventions and make necessary adjustments. This iterative process ensures that quality improvement efforts are robust, ethical, and compliant with relevant regulations. Question 11. Governance review demonstrates that the current system for reporting patient safety events is resulting in low voluntary reporting rates and a perceived lack of tangible improvements in care processes. Which of the following strategies would best address these findings and enhance the organization's patient safety reporting and learning system in alignment with established quality and safety frameworks? Option A. Mandate that all patient safety events be reported immediately to a central committee, with a strict policy of disciplinary action for any staff member involved in an event, regardless of intent. Option B. Implement a comprehensive, non-punitive reporting system that encourages all staff to report errors and near misses, coupled with a robust process for root cause analysis and dissemination of lessons learned across all relevant departments. Option C. Focus on developing a comprehensive training program for staff on reporting procedures, but defer any changes to the analysis or dissemination processes until after the training is completed. Option D. Enhance the existing reporting system by requiring detailed documentation of every minor deviation from protocol and establish a performance metric focused solely on the number of reports filed by each unit. The correct answer is B. Implement a comprehensive, non-punitive reporting system that encourages all staff to report errors and near misses, coupled with a robust process for root cause analysis and dissemination of lessons learned across all relevant departments. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare quality and patient safety, balancing the need for robust reporting of adverse events with the potential for a punitive culture that discourages transparency. The challenge lies in fostering an environment where staff feel safe to report errors without fear of retribution, while simultaneously ensuring that these reports lead to meaningful improvements. The governance review highlights a systemic issue, indicating that current processes may not be effectively achieving this balance. Professional judgment is required to identify the most effective strategy for enhancing the reporting and learning system, considering both human factors and regulatory expectations. Correct approach analysis. The correct approach focuses on creating a non-punitive reporting culture and implementing a structured learning process. This aligns directly with the core principles of patient safety and the regulatory framework for healthcare organizations, which emphasize continuous improvement and the prevention of harm. By encouraging voluntary reporting, organizations can gather a more comprehensive understanding of potential risks. The subsequent analysis and dissemination of lessons learned, without individual blame, promotes a systemic approach to error reduction. This fosters trust, encourages proactive identification of hazards, and ultimately leads to safer patient care, which is a primary objective mandated by regulatory bodies overseeing healthcare quality and patient safety. Incorrect approach is analysis. Implementing a mandatory, blame-focused reporting system would be a significant regulatory and ethical failure. Such an approach directly contradicts the principles of a just culture, which is a cornerstone of patient safety initiatives. Fear of punishment will lead to underreporting, masking systemic issues and preventing effective learning. This failure to capture accurate data hinders the organization's ability to identify and mitigate risks, potentially leading to repeated adverse events and noncompliance with quality improvement mandates. Focusing solely on individual disciplinary action for every reported event, without a systemic analysis, is another critical failure. This approach ignores the complex interplay of factors that contribute to medical errors, such as system design, workflow inefficiencies, and communication breakdowns. It creates a punitive environment, discouraging future reporting and failing to address the root causes of harm. Regulatory bodies expect organizations to demonstrate a commitment to systemic improvement, not just individual accountability, and this approach would fall short of that expectation. Establishing a reporting system that lacks a clear process for analysis and dissemination of lessons learned is also professionally unacceptable. A reporting system without a learning component is merely a data collection exercise. It fails to translate reported events into actionable improvements, thereby missing opportunities to enhance patient safety. This inaction can be viewed as a failure to meet the organization's ethical obligation to continuously improve care and a potential violation of regulatory requirements for quality assurance and performance improvement programs. Professional reasoning. Professionals facing this situation should first acknowledge the importance of a just culture, where reporting is encouraged and learning is prioritized over blame. The decision-making process should involve evaluating the current reporting system's effectiveness in capturing near misses and adverse events. Next, assess the organization's capacity for analyzing reported events to identify root causes and contributing factors. Finally, consider how lessons learned can be effectively communicated and integrated into practice to prevent recurrence. This systematic approach ensures that the organization is not only compliant with regulatory expectations for patient safety, but also actively working to create a culture of continuous improvement and patient well-being. Question 12. Strategic planning requires a healthcare organization to effectively integrate the requirements of multiple oversight bodies. A new hospital is developing its initial strategic plan and needs to consider the foundational expectations for quality and patient safety. Which of the following approaches best aligns with the multifaceted regulatory landscape of the United States healthcare system, encompassing accreditation, reimbursement, and quality performance? Option A. Formulate a strategic plan that proactively incorporates the distinct yet interconnected requirements of the Joint Commission, CMS, and NCQA, ensuring comprehensive compliance and performance improvement across all relevant domains. Option B. Design a strategic plan that centers on achieving NCQA accreditation for its physician practices and health plan, as this demonstrates a commitment to patient-centered care and quality measurement. Option C. Develop a strategic plan that prioritizes meeting the Joint Commission's accreditation standards, as this is the primary driver for organizational recognition and patient trust. Option D. Create a strategic plan that focuses exclusively on the conditions of participation mandated by CMS, as these are essential for Medicare and Medicaid reimbursement and operational continuity. Correct answer is C. Develop a strategic plan that prioritizes meeting the Joint Commission's accreditation standards, as this is the primary driver for organizational recognition and patient trust. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare quality and patient safety, navigating the overlapping yet distinct mandates of major regulatory bodies. A healthcare organization must align its strategic planning with the requirements of the Joint Commission, the Centers for Medicare and Medicaid Services, CMS, and the National Committee for Quality Assurance, NCQA, to ensure compliance, maintain accreditation, and optimize patient care. The challenge lies in understanding the specific focus and authority of each body and integrating their expectations into a cohesive organizational strategy. Failure to do so can result in accreditation deficiencies, loss of reimbursement, and ultimately, compromised patient safety. Correct approach analysis. The correct approach involves a comprehensive review of each regulatory body's current standards, guidelines, and survey methodologies. This includes understanding the Joint Commission's focus on accreditation and patient safety standards across a broad spectrum of healthcare services, CMS's role in regulating Medicare and Medicaid participation through conditions of participation, CHQPS, and quality reporting programs, and NCQA emphasis on quality measurement, performance improvement, and patient-centered care, particularly for health plans and physician organizations. A strategic plan that proactively incorporates the specific requirements and performance metrics of all three bodies, fostering interdepartmental collaboration and data integration, represents best professional practice. This ensures that the organization not only meets minimum compliance, but also strives for excellence in quality and safety, aligning with the overarching goals of these regulatory entities. Incorrect approaches analysis, focusing solely on the Joint Commission's accreditation standards, while important, is insufficient. This approach neglects the direct financial implications and patient access requirements mandated by CMS, which are critical for operational viability and serving vulnerable populations. It also overlooks NCQA's specialized focus on quality measurement and improvement, particularly relevant for organizations involved in managed care or accountable care models. Prioritizing only CMS conditions of participation ignores the broader accreditation and performance improvement expectations set by the Joint Commission and NCQA. While CMS compliance is essential for reimbursement, a narrow focus can lead to deficiencies in areas not directly addressed by CHQPS, impacting overall quality and patient experience. Concentrating exclusively on NCQA standards, often geared towards health plans and physician groups, may not fully encompass the facility-specific accreditation requirements of the Joint Commission or the broad patient care regulations of CMS applicable to hospitals and other providers. This can lead to gaps in accreditation status and compliance with essential patient safety protocols. Professional reasoning. Healthcare leaders must adopt a systematic approach to regulatory compliance and quality improvement. This involves 1. Identifying all relevant regulatory bodies and their specific mandates applicable to the organization's services and operational structure. 2. Conducting a thorough gap analysis between current organizational practices and the requirements of each regulatory body. 3. Prioritizing initiatives based on impact on patient safety, quality of care, regulatory compliance, and financial sustainability. 4. Developing integrated strategic plans that address the requirements of all relevant bodies concurrently, fostering cross-functional collaboration. 5. Establishing robust monitoring and evaluation systems to track progress and ensure ongoing compliance and performance improvement. 6. Staying abreast of changes in regulations and standards from all governing bodies. Question 13. Operational review demonstrates that a patient scheduled for a routine procedure has expressed significant apprehension about a specific post-operative safety protocol, requesting an alternative that they believe is less intrusive. The clinical team, while acknowledging the patient's concern, believes the standard protocol is the most effective for preventing a known complication. The team is now deciding how to proceed, considering the patient's expressed wishes versus the established safety guideline. Option A. The clinical team should proceed with the standard post-operative safety protocol as planned, informing the patient that it is the most effective method and that their concerns, while noted, cannot override established safety procedures. Option B. The clinical team should defer to the patient's request for an alternative protocol without further discussion, assuming the patient's research or understanding is sufficient to justify their preference. Option C. The clinical team should implement the standard protocol and document the patient's apprehension, but not actively seek to address or involve the patient in finding a mutually agreeable solution, as the primary responsibility for safety lies with the healthcare provider. Option D. The clinical team should engage in a detailed discussion with the patient, explaining the rationale behind the standard protocol, exploring the patient's specific concerns and fears, and collaboratively exploring potential modifications or alternative approaches that still meet the core safety objectives, respecting the patient's right to informed decision-making. The correct answer is D. The clinical team should engage in a detailed discussion with the patient, explaining the rationale behind the standard protocol, exploring the patient's specific concerns and fears, and collaboratively exploring potential modifications or alternative approaches that still meet the core safety objectives, respecting the patient's right to informed decision-making. Explanation. This scenario presents a common ethical dilemma in healthcare quality and patient safety, specifically concerning patient engagement in safety practices. The challenge lies in balancing the organization's responsibility to ensure patient safety with the patient's right to autonomy and informed decision-making, all within the framework of U.S. healthcare regulations and ethical principles governing patient care. The correct approach represents best professional practice because it prioritizes patient autonomy and informed consent, which are fundamental ethical and legal tenets in U.S. healthcare, empowering patients to participate in their safety by providing them with clear, understandable information and respecting their choices, even if those choices differ from the provider's initial recommendation, aligns with the principles of patient-centered care and shared decision-making. This approach fosters trust, improves adherence to safety protocols, and ultimately enhances patient outcomes. Regulations such as the Health Insurance Portability and Accountability Act, HIPAA, indirectly support this by emphasizing patient rights to access their health information and make informed decisions about their care. Ethical guidelines from professional organizations also strongly advocate for patient involvement. An incorrect approach that involves overriding the patient's expressed wishes, even with the intention of ensuring safety, fails to respect patient autonomy. This can lead to a breach of trust, patient dissatisfaction, and potential legal repercussions. Ethically, it violates the principle of beneficence, acting in the patient's best interest, by disregarding the patient's own definition of what is best for them, and it infringes upon their right to self-determination. Legally, it could be construed as battery or a violation of informed consent principles, depending on the specifics of the situation and state laws. Another incorrect approach, which is to simply dismiss the patient's concerns as non-essential to safety, demonstrates a lack of patient-centeredness and a failure to recognize the holistic nature of patient care. Patients often have unique perspectives and experiences that are crucial for identifying and mitigating safety risks. Ignoring these can lead to missed opportunities for improvement and can alienate patients, making them less likely to engage in future safety initiatives. This approach also neglects the ethical obligation to actively listen to and address patient concerns. Finally, an approach that involves a paternalistic stance, where the healthcare team makes all decisions without adequately involving the patient, is ethically and legally problematic. While healthcare professionals are experts, patient preferences and values must be integrated into care plans. This paternalism undermines the patient's role in their own health journey and can lead to care that is not aligned with their goals or values, potentially impacting their willingness to adhere to safety measures. The professional decision-making process for similar situations should involve a thorough assessment of the patient's understanding, preferences, and values. It requires open and honest communication, providing information in an accessible format, and actively listening to the patient's concerns. When disagreements arise, the focus should be on finding common ground and collaboratively developing a plan that respects both the patient's autonomy and the healthcare team's professional judgment, always prioritizing patient safety within the bounds of ethical and legal requirements. Question 14. The monitoring system demonstrates a consistent pattern of patient handoffs occurring outside the established, evidence-based protocol designed to ensure continuity of care and patient safety. Which quality management approach is most appropriate to address this finding? Option A. Conduct a one-time training session on the existing handoff protocol for all involved staff. Option B. Implement a comprehensive quality improvement initiative to identify the root causes of protocol deviation and develop sustainable solutions. Option C. Document the deviations in patient charts and await further instructions from the quality department. Option D. Issue a directive to all staff reinforcing the existing handoff protocol and conducting immediate disciplinary actions for noncompliance. The correct answer is B. Implement a comprehensive quality improvement initiative to identify the root causes of protocol deviation and develop sustainable solutions. Explanation. This scenario presents a common challenge in healthcare quality management, distinguishing between activities focused on maintaining current standards and those aimed at achieving higher levels of performance. The monitoring system's findings, indicating a deviation from established protocols, require a nuanced response. The professional challenge lies in correctly identifying the appropriate quality management strategy to address the identified issue, ensuring both immediate compliance and long-term improvement. The correct approach involves recognizing that a deviation from established protocols necessitates a quality improvement initiative. Quality improvement is a systematic process that aims to enhance patient care and organizational performance. It involves identifying problems, analyzing root causes, developing and implementing solutions, and monitoring the results. In this context, simply ensuring adherence to existing protocols, quality assurance, would be insufficient if those protocols themselves are not optimal or if the deviation indicates a systemic issue that needs a more comprehensive solution. A quality improvement approach would involve investigating why the deviation occurred, whether the protocol needs revision, or if there are training or resource gaps contributing to the issue. This aligns with the core principles of patient safety and quality mandated by regulatory bodies that emphasize continuous learning and adaptation to improve outcomes. An incorrect approach would be to solely focus on quality assurance by simply re-emphasizing adherence to the existing protocol without further investigation. This fails to address the underlying reasons for the deviation and misses an opportunity for systemic improvement. Ethically, this could lead to a recurrence of the issue and potentially compromise patient safety if the deviation itself points to a flaw in the protocol or its implementation. Another incorrect approach would be to dismiss the deviation as an isolated incident without any follow-up. This neglects the potential for broader systemic issues and violates the ethical obligation to proactively manage risks and ensure the highest standards of care. Regulatory frameworks, such as those overseen by CMS in the U.S., emphasize a proactive and systematic approach to quality, requiring organizations to not only monitor, but also to actively improve their processes and outcomes. Professionals should approach such situations by first understanding the nature and scope of the deviation. This involves data analysis to determine if it's an isolated event or a trend. If it's a trend or a significant deviation, the next step is to engage in root cause analysis, which is a hallmark of quality improvement. This analysis should involve relevant stakeholders to understand contributing factors. Based on the root cause analysis, a plan for improvement should be developed, implemented, and rigorously monitored. This iterative process of assessment, intervention, and evaluation is fundamental to effective healthcare quality management and is often a requirement of regulatory compliance. Question 15. Stakeholder feedback indicates a recurring pattern of communication breakdowns between the night shift nursing staff and the day shift physicians regarding critical patient status changes, leading to potential delays in timely interventions. As a patient safety officer, what is the most appropriate initial step to address this concern? Option A. Rely on the existing incident reporting system to capture future communication failures, assuming that individual reports will eventually highlight the systemic issue. Option B. Immediately implement a mandatory daily huddle for all staff at the beginning of each shift to discuss patient status, bypassing formal analysis to ensure rapid communication. Option C. Instruct the night shift nurses to document all critical patient changes in a separate logbook that day shift physicians are required to review before their rounds. Option D. Convene a multidisciplinary team, including representatives from nursing, physicians, and quality improvement, to conduct a root cause analysis of the communication breakdowns and develop evidence-based solutions. The correct answer is D. Convene a multidisciplinary team, including representatives from nursing, physicians, and quality improvement, to conduct a root cause analysis of the communication breakdowns and develop evidence-based solutions. Explanation. This scenario is professionally challenging because it requires balancing immediate patient safety concerns with the need for systemic improvement and adherence to established quality improvement processes. The pressure to act quickly to address a perceived safety gap must be weighed against the potential for unintended consequences or the bypassing of evidence-based decision-making. Careful judgment is required to ensure that interventions are effective, sustainable, and aligned with the organization's commitment to patient safety and regulatory compliance. The correct approach represents best professional practice because it prioritizes a systematic, data-driven investigation of the reported issue. This aligns with the core principles of patient safety, which emphasize understanding the root causes of adverse events or near misses rather than simply addressing symptoms. By engaging a multidisciplinary team and utilizing established quality improvement methodologies, the organization demonstrates a commitment to evidence-based practice and continuous learning. This approach is ethically sound, as it seeks to implement robust solutions that benefit all patients, and it is compliant with regulatory expectations that often mandate structured quality improvement processes and a culture of safety. An incorrect approach that focuses solely on immediate, unverified changes risks implementing ineffective or even harmful interventions. This could lead to a failure to address the true underlying problem, wasting resources and potentially creating new safety risks. Ethically, this approach fails to uphold the principle of beneficence by not ensuring the intervention is truly beneficial. From a regulatory perspective, it may violate requirements for evidence-based practice and documented quality improvement initiatives. Another incorrect approach that involves bypassing established protocols for reporting and investigating safety concerns undermines the organization's safety culture. This can lead to a lack of transparency, hinder learning from errors, and create a perception that safety is not a priority. Ethically, it can lead to a failure to adequately support staff involved in adverse events and may prevent necessary systemic changes. Regulatory bodies often emphasize the importance of robust reporting systems and thorough investigations as cornerstones of patient safety compliance. A third incorrect approach that relies on anecdotal evidence or individual opinions without systematic data collection or analysis is not conducive to sustainable quality improvement. While individual experiences are valuable, they must be validated and contextualized within broader data to identify systemic issues. This approach can lead to biased decision-making and may not reflect the true scope or nature of the patient safety problem. It fails to meet the standards of evidence-based practice expected in healthcare quality and patient safety, and may not satisfy regulatory requirements for data-driven quality initiatives. The professional decision-making process for similar situations should involve a structured approach. 1. Acknowledge and validate the stakeholder feedback, recognizing its importance in identifying potential safety issues. 2. Initiate a prompt but thorough assessment of the reported concern. This may involve initial data gathering and a preliminary risk assessment. 3. Engage the appropriate multidisciplinary team, including those with expertise in the area of concern, quality improvement and patient safety. 4. Utilize established quality improvement methodologies, e.g., root cause analysis, failure modes, and effects analysis, to systematically investigate the issue, identify contributing factors, and determine root causes. 5. Develop evidence-based interventions designed to address the identified root causes. 6. Implement, monitor, and evaluate the effectiveness of the interventions, making adjustments as needed. 7. Communicate findings and changes to relevant stakeholders to foster transparency and continuous learning. 8. Ensure all actions are documented and aligned with organizational policies and regulatory requirements. Question 16. Governance review demonstrates that while departmental efficiency metrics have improved, there is an increasing trend in reported near misses related to medication administration. Which process optimization approach best upholds the principles of patient safety and quality care within the CHQPS framework? Option A. Conduct a comprehensive root cause analysis of all medication-related near misses to identify underlying system vulnerabilities and implement targeted process redesigns. Option B. Prioritize the implementation of new, expensive technology for medication dispensing without first evaluating current workflow inefficiencies. Option C. Implement mandatory overtime for pharmacy technicians to expedite prescription fulfillment, thereby reducing wait times and potential for errors. Option D. Focus on retraining nursing staff on medication administration protocols, assuming individual error is the primary driver of near misses. The correct answer is A. Conduct a comprehensive root cause analysis of all medication-related near misses to identify underlying system vulnerabilities and implement targeted process redesigns. Explanation: this scenario is professionally challenging because it requires balancing immediate operational demands with the long-term strategic imperative of patient safety, a core tenet of healthcare quality. The pressure to demonstrate efficiency through process optimization can inadvertently lead to overlooking critical safety protocols if not approached with a patient-centered mindset. Careful judgment is required to ensure that efficiency gains do not compromise the integrity of care delivery or introduce new risks. The correct approach represents best professional practice because it directly aligns with the fundamental principles of patient safety and quality improvement, which are paramount in healthcare. By focusing on identifying and mitigating systemic risks within existing processes, this approach proactively enhances patient outcomes and reduces the likelihood of adverse events. This is ethically mandated by the professional responsibility to do no harm, and is often reinforced by regulatory frameworks that emphasize a culture of safety and continuous improvement. An incorrect approach that prioritizes cost reduction without a thorough patient safety impact assessment is ethically flawed. It risks violating the principle of beneficence by potentially exposing patients to harm in the pursuit of financial targets. This could also lead to regulatory noncompliance if it results in deviations from established safety standards or protocols mandated by governing bodies. Another incorrect approach that focuses solely on staff training without addressing underlying system vulnerabilities fails to achieve sustainable patient safety improvements. While training is important, it cannot compensate for flawed processes or inadequate resources. Ethically, this approach is insufficient as it places the burden of safety on individual staff members rather than addressing systemic issues, potentially leading to burnout and continued risk. Furthermore, it may not meet regulatory expectations for robust quality management systems that require proactive risk identification and mitigation. A professional decision-making process for similar situations should begin with a clear understanding of the organization's mission and values, with patient safety at the forefront. This involves a systematic assessment of proposed changes, utilizing tools like root cause analysis and failure mode and effects analysis to understand potential impacts on patient care. Stakeholder engagement, including frontline staff and patients, is crucial for gathering comprehensive insights. Decisions should be guided by evidence-based practices and a commitment to transparency and accountability, ensuring that all actions are justifiable from both a clinical and ethical perspective, and in compliance with relevant healthcare regulations. Question 17. Risk assessment procedures indicate a potential decline in patient satisfaction scores related to communication breakdowns between nursing staff and physicians during shift changes. Leadership is considering strategies to address this issue. Which of the following leadership approaches best aligns with fostering a culture of quality improvement and patient safety within the U.S. regulatory framework? Option A. Implement a mandatory, standardized handoff protocol with clear documentation requirements and conduct regular audits of compliance, providing feedback directly to unit managers for performance review. Option B. Convene a task force comprised of senior leadership and department heads to develop a new communication policy, which will then be disseminated to all staff for mandatory adherence. Option C. Schedule a series of town hall meetings where frontline nurses and physicians can openly discuss their challenges and collaboratively brainstorm potential solutions, with leadership actively participating and committing resources to support feasible initiatives. Option D. Allocate additional resources for overtime pay for nurses and physicians to ensure adequate staffing during shift changes, believing that increased presence will naturally improve communication. The correct answer is A. Implement a mandatory standardized handoff protocol with clear documentation requirements and conduct regular audits of compliance, providing feedback directly to unit managers for performance review. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for operational efficiency with the long-term imperative of fostering a culture of safety and continuous improvement, which are cornerstones of healthcare quality and patient safety as defined by U.S. regulatory frameworks such as the Affordable Care Act, ACA, and guidelines from organizations like the Joint Commission. Leadership's role in quality improvement is not merely about implementing new processes, but about actively engaging all stakeholders, from frontline staff to executive management, in identifying risks and driving positive change. The challenge lies in ensuring that quality initiatives are not perceived as punitive or burdensome, but as integral to the organization's mission and patient outcomes. The correct approach represents best professional practice because it demonstrates proactive leadership engagement in quality improvement by actively soliciting input from frontline staff. This aligns with regulatory expectations that healthcare organizations foster a culture where staff feel empowered to report concerns and participate in solutions without fear of reprisal. Such engagement is crucial for identifying latent safety threats and for developing sustainable improvement strategies that are grounded in the realities of clinical practice. This approach directly supports the principles of patient safety and quality mandated by CMS and promoted by patient safety organizations, emphasizing transparency and collaborative problem-solving. An incorrect approach that focuses solely on top-down directives without engaging frontline staff fails to leverage the expertise of those closest to patient care. This can lead to the implementation of superficial solutions that do not address the root causes of quality issues and may even create new risks or inefficiencies. Ethically, it neglects the professional responsibility to involve all relevant parties in decisions that impact patient care and safety. From a regulatory standpoint, it can be seen as a failure to establish a robust quality management system that incorporates diverse perspectives, a requirement often implicitly or explicitly expected by accrediting bodies and CMS. Another incorrect approach that prioritizes immediate cost savings over quality improvement initiatives is ethically and regulatorily unsound. Healthcare quality and patient safety are paramount, and any decision that compromises these for financial gain is a direct violation of professional ethics and regulatory mandates. CMS, for instance, has specific requirements for quality reporting and performance improvement that are directly tied to reimbursement, underscoring the non-negotiable nature of quality in healthcare. Such a focus can lead to a decline in patient outcomes, increased adverse events, and ultimately, greater financial costs due to complications and readmissions, undermining the organization's long-term viability and mission. The professional decision-making process for similar situations should involve a systematic approach that begins with a thorough understanding of the identified risks and their potential impact on patient safety and quality. Leaders must then actively seek input from all levels of the organization, particularly frontline staff, to gain a comprehensive perspective. Quality improvement initiatives should be data-driven, evidence-based, and aligned with organizational strategic goals and regulatory requirements. Leadership's role is to champion these initiatives, allocate necessary resources, and foster an environment that supports continuous learning and improvement, ensuring that patient well-being remains the ultimate priority. Question 18. The risk matrix shows a high likelihood and severe impact associated with a recent accreditation survey finding related to medication reconciliation processes. The organization's leadership is considering how to best address this critical finding to ensure patient safety and maintain accreditation. Which of the following approaches best aligns with accreditation standards for quality and patient safety? Option A. Post updated medication reconciliation protocols on the hospital intranet and instruct department managers to ensure their staff review them. Option B. Immediately implement mandatory, organization-wide retraining on medication reconciliation for all clinical staff, assuming the issue is a lack of knowledge. Option C. Form a multidisciplinary team to conduct a thorough root cause analysis of the medication reconciliation failures. Develop a targeted action plan with measurable outcomes, and implement a robust monitoring system to track progress and ensure sustainability. Option D. Defer significant remediation efforts until the next budget cycle, citing current resource limitations, while continuing with existing, albeit flawed, processes. The correct answer is C. Form a multidisciplinary team to conduct a thorough root cause analysis of the medication reconciliation failures, develop a targeted action plan with measurable outcomes, and implement a robust monitoring system to track progress and ensure sustainability. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing immediate operational pressures with the long-term strategic imperative of maintaining accreditation. The organization is facing a critical gap identified by an accrediting body, which directly impacts patient safety and the organization's ability to operate. The challenge lies in prioritizing resources and actions to address the identified deficiency effectively, while minimizing disruption to ongoing patient care and other essential services. The risk matrix highlights a significant potential negative impact, demanding a prompt and well-considered response. Correct approach analysis. The correct approach involves a systematic, data-driven, and collaborative strategy that directly addresses the root cause of the identified deficiency. This aligns with the core principles of accreditation standards, which emphasize continuous improvement, patient safety, and evidence-based practice. By forming a multidisciplinary team, conducting a thorough root cause analysis, developing a targeted action plan with measurable outcomes, and implementing robust monitoring, the organization demonstrates a commitment to sustainable quality improvement. This approach is best professional practice because it ensures that the remediation efforts are not merely superficial, but address the underlying systemic issues, thereby preventing recurrence and fostering a culture of safety. This aligns with the expectations of accrediting bodies that require organizations to proactively manage risks and demonstrate measurable improvements in quality and safety. Incorrect approaches analysis. One incorrect approach involves solely relying on superficial training without investigating the underlying systemic issues. This fails to address the root cause of the deficiency, making it likely that the problem will re-emerge. Ethically, this is a failure to provide effective patient care and safety measures, and regulatorily, it demonstrates a lack of commitment to the spirit and intent of accreditation standards, which demand systemic solutions. Another incorrect approach is to delay action due to resource constraints, without a clear plan for future resource allocation or seeking external support. This inaction poses a direct risk to patient safety and can lead to significant penalties from the accrediting body, including potential loss of accreditation. It represents a failure to prioritize patient well-being and a disregard for regulatory compliance. A third incorrect approach is to implement a broad, uncoordinated set of changes across the organization without a clear understanding of the specific deficiency or a plan for evaluation. This can lead to wasted resources, staff confusion, and may not effectively address the identified problem. It demonstrates a lack of strategic planning and a failure to adhere to the principles of evidence-based quality improvement mandated by accreditation standards. Professional reasoning. Professionals facing such a situation should first acknowledge the seriousness of the identified deficiency and its potential impact on patient safety and accreditation status. The decision-making process should involve 1. Understanding the specific requirements of the accrediting body and the identified gap. 2. Engaging relevant stakeholders, including frontline staff, leadership, and quality improvement professionals, to gather comprehensive information. 3. Utilizing a structured problem-solving methodology such as root cause analysis to identify underlying issues. 4. Developing a smart, specific, measurable, achievable, relevant, time-bound action plan. 5. Establishing clear metrics for success and a robust monitoring system. 6. Communicating progress and challenges transparently to all stakeholders. This systematic approach ensures that interventions are targeted, effective, and sustainable, thereby upholding professional responsibility and regulatory compliance. Question 19. The efficiency study reveals a significant increase in patient wait times in the emergency department. Which quality improvement framework is most appropriate for systematically addressing this issue and ensuring sustained positive outcomes, adhering to U.S. healthcare quality and patient safety regulations? Option A. Initiating a short-term project to streamline patient registration, with no plan for post-project evaluation of wait times. Option B. Adopting a broad total quality management (TQM) philosophy for the entire hospital, with a general goal of improving patient flow. Option C. Implementing a continuous quality improvement (CQI) cycle that involves data collection, root cause analysis, testing of interventions, and ongoing monitoring of wait times. Option D. Conducting a one-time training session for all emergency department staff on time management techniques. The correct answer is C. Implementing a continuous quality improvement (CQI) cycle that involves data collection, root cause analysis, testing of interventions, and ongoing monitoring of wait times. Explanation. The efficiency study reveals a significant increase in patient wait times in the emergency department, directly impacting patient satisfaction and potentially leading to adverse events. This scenario is professionally challenging because it requires a healthcare quality professional to not only identify the problem, but also to select the most appropriate framework for addressing it within the established regulatory and ethical landscape of healthcare quality and patient safety. The choice of framework has direct implications for resource allocation, staff engagement, and the ultimate effectiveness of the improvement initiative. The correct approach, focusing on continuous quality improvement (CQI), represents best professional practice because it aligns with the core principles of ongoing, systematic efforts to improve healthcare processes and outcomes. CQI emphasizes data-driven decision-making, iterative testing of changes, and a culture of learning and adaptation. Regulatory frameworks for healthcare quality, such as those overseen by CMS, Centers for Medicare and Medicaid Services, and accrediting bodies like the Joint Commission, mandate or strongly encourage the use of CQI principles to ensure patient safety and high-quality care. Ethically, CQI demonstrates a commitment to patient well-being by proactively seeking to reduce harm and improve the patient experience. An approach that solely relies on total quality management, TQM, without a specific focus on iterative, data-driven cycles might be less effective in this dynamic environment. While TQM emphasizes customer satisfaction and continuous improvement, its broader, more philosophical approach may not provide the granular, actionable steps needed for rapid problem-solving in an emergency department setting. A failure to adopt a structured, data-informed CQI process could lead to superficial changes that do not address the root causes of increased wait times, potentially violating ethical obligations to provide timely care and regulatory expectations for demonstrable quality improvement. Another incorrect approach would be to implement a one-time, project-based solution without a plan for ongoing monitoring and adaptation. This neglects the fundamental principle of continuous improvement and risks the problem recurring once the initial project concludes. Such an approach fails to meet the spirit and often the letter of regulatory requirements that expect sustained quality performance. Ethically, this represents a failure to commit to long-term patient safety and satisfaction. Finally, focusing solely on staff training without addressing systemic process issues would be an inadequate response. While staff competency is crucial, increased wait times are often indicative of systemic bottlenecks or inefficiencies that training alone cannot resolve. This approach would be a regulatory failure if it bypasses the requirement to analyze and improve processes, and an ethical failure if it places the burden of a systemic problem solely on individual staff members, without providing the necessary environmental support. The professional decision-making process should involve 1. Clearly defining the problem with measurable data. 2. Identifying potential root causes through a systematic process, e.g., fishbone diagram process mapping. 3. Selecting a quality improvement framework that supports iterative testing and data analysis, CQI. 4. Developing and implementing changes. 5. Rigorously measuring the impact of those changes. And 6. Establishing mechanisms for ongoing monitoring and further refinement, all within the purview of applicable U.S. healthcare regulations and patient safety standards. Question 20. Assessment of the most appropriate data collection method for measuring patient experience with a newly implemented discharge process, considering the need for both objective adherence data and subjective patient feedback. Option A. Relying solely on staff self-reporting of their adherence to the new discharge process steps. Option B. A mixed methods approach combining patient surveys administered post-discharge with retrospective chart reviews to verify process adherence. Option C. Implementing real-time direct observation of every patient discharge by a dedicated quality improvement observer. Option D. Utilizing only retrospective chart reviews to document the completion of discharge process steps. Correct answer is B. A mixed methods approach combining patient surveys administered post-discharge with retrospective chart reviews to verify process adherence. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare quality improvement, selecting the most appropriate data collection method for a specific quality metric. The challenge lies in balancing the need for accurate, reliable data with practical considerations such as resource availability, patient burden, and the potential for bias. Choosing a method that is too resource-intensive might be unsustainable, while a method that is too simplistic might yield data that is not granular or representative enough to drive meaningful improvements. The professional challenge is to identify a method that is both scientifically sound and operationally feasible within the healthcare setting, ensuring that the collected data accurately reflects the intended quality measure. Correct approach analysis. The correct approach involves a systematic evaluation of available data collection methods against the specific requirements of the quality metric, considering factors like data source, timeliness, cost, and potential for bias. For a metric focused on patient experience with a new discharge process, a mixed methods approach combining patient surveys to capture subjective experiences with chart reviews to validate objective adherence to the process offers the most comprehensive and robust data. Patient surveys, when well designed and administered, provide direct insight into patient perceptions and satisfaction, aligning with the intent of measuring experience. Chart reviews offer objective verification of whether the new discharge process steps were actually followed, providing a crucial layer of validation. This combination mitigates the limitations of each individual method, leading to a more accurate and actionable understanding of quality. This aligns with best practices in quality measurement, which emphasize triangulation of data from multiple sources to enhance validity and reliability, as advocated by quality improvement frameworks like the Institute for Healthcare Improvement (IHI). Incorrect approaches analysis. Relying solely on staff self-reporting of adherence to the new discharge process is problematic because it is highly susceptible to social desirability bias and recall bias. Staff may overstate their adherence to appear compliant, and their memory of specific instances may be inaccurate. This fails to provide an objective measure of process execution and does not capture the patient's perspective, which is central to measuring patient experience. This approach lacks the rigor required for reliable quality measurement and could lead to erroneous conclusions about the effectiveness of the new process. Using only retrospective chart reviews to assess patient experience with the discharge process is insufficient. While chart reviews can confirm if specific procedural steps were documented, they cannot capture the patient's subjective feelings, satisfaction, or perceived quality of care during the discharge. Patient experience is inherently qualitative and personal, and objective documentation alone cannot fully represent it. This method would provide a measure of process adherence, not patient experience, failing to meet the stated objective of the quality metric. Implementing a real-time observation of every patient discharge is often impractical and resource-prohibitive in a busy healthcare setting. While it offers the highest potential for objective data collection, the cost, disruption to workflow, and potential for observer bias make it unsustainable for ongoing quality measurement. Furthermore, it still might not fully capture the patient's subjective experience unless specifically designed to do so, which would add further complexity. This approach prioritizes an ideal but often unattainable level of data collection over a practical and effective method. Professional reasoning. Professionals should approach data collection method selection by first clearly defining the quality metric and its specific objectives. Then, they should identify potential data sources and methods, evaluating each for its ability to accurately and reliably capture the desired information. This evaluation should consider feasibility, cost, potential for bias, and ethical implications. A systematic, evidence-based approach, often involving a multidisciplinary team, is crucial. When faced with multiple viable options, professionals should select the method or combination of methods that offers the best balance of accuracy, reliability, and practicality, ensuring the data collected will support meaningful quality improvement efforts and align with regulatory expectations for data integrity and patient-centered care.